Hi, this is Rizwan, and you are watching the Indian Weekender. Ever since we went into the second wave of lockdown 3 weeks ago, there has been a surge in COVID testing, hospital visits, and consultations pertaining to having COVID symptoms. Hospitals and district health boards are under immense stress to once again deal with the increased number of visitors and to convey the message to the community about taking proper precautionary measures when in public or at house to avoid community transmission. The risk? The risk and the stakes are very high when we talk about community transmission. Thousands of patients visit scores of clinics under any DHB on a daily basis. And even one unintentional or careless action can have huge repercussions, not just for one family, one community, but for the entire country. In the last 3 weeks, we have had over 150,000 tests done by Ministry of Health and a surge in visits to hospitals and district health board clinics. And in total, today we have over 100 active cases in the community. In this regard, today we'll be talking to a senior medical officer from Counties Manukau Health, Dr. Hari Talreja, about the latest updates on COVID-19 testing. What are the policies around people visiting hospital, either for consultation or for seeing family members? Hello, Dr. Hari, how are you doing today?
I'm very well, Rizwan. Thank you so
So
much
good
for
to
having me.
have you on our in our virtual studio. But to start off with, could you tell us a little more about what is the current scenario at DHBs, particularly at Counties Manukau Health Clinic?
Right. So at Counties, Manukau and Middlemore is a part of that. We've got right now 4 cases of COVID patients, out of which one is in the ICU and 3 are being managed separately in isolation. And um, we've taken all the precautions. We had time to prepare for this, and we've got plans in place for different measures which we need to take around patients with COVID positive.
Right. And how many patients are you seeing at the hospital or at the clinics on a daily basis?
So we see a lot of patients in the hospital, and right now the main focus has been in the hospital is to try and restrict the visitors because, as you mentioned earlier, Iswan, um, the biggest concern here is of community transmission. And just to give you a sense, we get roughly about 2,000 visitors just at Middlemore Hospital, which is one part of counties. We've got other outpatient sites as well. So imagine if you have to kind of screen and test and you know get the
Contact
information,
trace.
yeah, get the information of those people for contact tracing. For 2,000 people, that's a lot. Hence we have come
And
up with this visitor restriction policy.
so is that on a daily basis that you see so many patients?
Yeah, I mean, we were talking about the visitors, yes, but the Millmore Hospital generally tends to be full. It's winter period, so most of the healthcare system in winter, where we call it the flu season, just tends to be the hospital tends to be completely chock a block.
Right. And although you're trying to reduce the numbers of visitors at the hospitals, but when people come, what precautions is the hospital or the clinics taking when it comes to seeing the patient one on one?
Right. So we have restricted the visitors, and then the policy is basically we are allowing only those visitors on essential or compassionate grounds or birthing partners, basically. So when we talk about compassionate ground, we're talking about somebody who's dealing with end of life care. Let's say if a child is admitted and need a parent to be around. For maternity, we want the partners to be around, so that's what we allow. Or if somebody needs additional support, let's say somebody's not an English speaking person and needs additional support, in that case we allow those visitors. um, Having said that, if you want to come and visit your loved one at the hospital, you need to make arrangements prior to that. So we are advising people to talk to the charge nurses and the wards where their loved ones are admitted so that we can pre-arrange all these things. We are screening, we are registering such visitors when they come to the hospitals. Our staff, our friendly staff actually, um, you, people will meet them at the entrances so that we can register them, which will also help us in contact tracing down the road. And just mind you, we are not letting children under the age of 15 come into the hospital yet.
Right. So, what are the services which are stopped or paused at this point of time during alert level 3 and probably in alert level 2 as well? What are the services which are not being offered at this point of time?
So all the elective surgeries have been put on hold for now. I mean, they've been postponed. And outpatient clinic services, especially in the localities, the community centers that we have, we put them on pause electively. In fact, what we've done is we've converted most of those clinics into telehealth consultations, which means
Hmm.
telephone or by video consultations. So just yesterday, I did a telephone consultation for all the clinic patients, and we're trying to at least address the ongoing issues over the phone so that they are not neglected. But at the same time, we want to reduce the risk. The idea is because there is evidence of community transmission, we want our patients who are in the hospital and our staff working with us to be really safe, because our patients and our staff are really a number one priority. Um, as you can imagine, the patients are sick, so they'll be vulnerable, and we need to make
Yes.
sure that they are well protected.
Right. I really want to talk to you about the community transmission and the gravity of community transmission it can have on in the public. But before that, from a doctor's perspective, could you explain to us and for the benefit of our viewers once again the importance of keeping oneself sanitized, wearing masks, and taking all the necessary precautions when out in public from a doctor's
Absolutely.
perspective?
Absolutely. I mean, the key to controlling this pandemic is twofold. One is the responsibility of the community. The second is the response of the healthcare system. We are trying to do as much as possible, but mind you, no healthcare system in this world is going to be able to deal with this pandemic if people don't kind of take the precautions that we are requesting, we are asking them to. So uh, the biggest contribution from the community has to be that they take measures so that they do not spread, they do not pick up for themselves, which anyways, why do you want to be sick? And the second thing is to avoid this community transmission. So simple measures, 20-second hand washing. Mind you, it has to be 20-second good soap hand wash. If you're coughing, if you're sneezing, use your elbow crease. Do not cough outside. And now, if you're using the public transport, you're supposed to be wearing mask, otherwise you'll be penalized, and that's a new rule in place. Simple thing: if you're not well, please stay at home. Please get tested. Do not come outside your home. Do not go to work. So simple measures will go really a long way in controlling this pandemic.
Right. So we have been hearing this information about taking precautions again and again for the last 6 months now, and so far the results have been relatively good. But moving on to community transmission, uh, could you explain in the last 6 months you might have seen hundreds of patients uh, at the hospitals or at different places. Could you explain to us the gravity of community transmission and how one single case can have huge repercussions in the community? Have you had any
Absolutely.
personal experiences or in your professional experience?
So I have had a personal experience in the sense my own brother and uncle in India, they had COVID-19, and thankfully they have both recovered. But the key here is we need to understand, the people need to understand, like we say flu is contagious, this is twice as contagious as flu. So the risk of somebody picking up is really high because this can spread very, very quickly, and you just need one case. And we've seen it across the world. It's important lessons to learn from how other things have happened in US, things have happened in South Korea. We had one single case, and that led to what we call a super spreader. And therefore, anybody who's sick has to make sure that you do not spread this, because this is easily contagious. And even if a slight, what should I say, you know, people can be ignorant, people could be relaxed about this. They shouldn't be, because this has the potential. So you can have one case and you can have a cluster out of that, and then the impact of that one single case, not just on other people, but the number of contact tracing that we have to do, the number of tests we have to do, the number of number of measures we have to take in the hospital sector, in the public health system. it really kind of takes a toll on that. So just be responsible towards yourself and towards the community is what I would say.
Right. I want to get your opinion as a senior medical officer that when such a situation comes, what kind of pressure it creates on the hospital. I'm not talking about the structure, but I'm talking about the people who are working at the hospital, the doctors, the nurses, the support staff, the people at the reception. So, what kind of impact, both mental and the work wise, what kind of impact it has on the people who are working at the hospitals during such a situation?
So Rizwan, because um, something like this and it's going on world over and we don't want to be in a situation like Europe, we had taken a lot of care. There's a lot of effort, there's a lot of preparation, there are a lot of meetings that we had to do to come up with contingency plans. um, we had to imagine all the situations. What if, like, I deal with dialysis patients and transplant patients, so what if one of our transplant patients picks up an infection? How do we deal with the rest? How do we prevent it spreading to the other people? What if it occurs in a dialysis unit where you have multiple other patients dialyzing there? How do we protect them? So there are heaps of factors we had to deal with, and lots of preparation, a lot of change in the way we do things routinely. The elective surgeries could have been done, but these have been put on hold. We're trying to create a balance between the risk and kind of continuing our life in routinely. People, especially the staff, obviously it's a stressful situation. We've seen evidence of that coming from US as well. um, it is stressful. Thankfully we've got a lot of resources within the BHP for the staff to kind of take care of. Some people who are, even the staff, some of them are, they've got conditions, so they're working from home as much as possible. So such
Mhm.
measures have been taken in place. Education about personal protective equipment, how to wear the mask correctly, how to take care of these simple precautions. Because, mind you, if I become sick and I'm seeing patients, I will be passing it on to other people. So we have to take all those care. How do we manage patients in an isolation ward? What happens if we have more number of patients than the capacity we have? So all these scenarios have been kind of planned and prepared for, and that takes a lot of effort and energy. And the staff has been really working overtime, and they've done really a good job to kind of put the best foot forward and try and control this. So there's a lot of things which go behind the scenes, which our community probably may not be aware, and therefore
Yes.
this is a good opportunity kind of to let them know that a simple, what should I say, miscalculated step from somebody, taking it easy, or just
Absolutely.
has a lot of repercussions on the healthcare system.
So, yes, I must admit that your answer, the way you have mentioned that the kind of stress it creates on every bit, it's like a domino effect in the hospital. If one person gets sick, how it affects the community overall, as well as every person in the hospital or the patients who are coming in the hospital or clinics. So you people really need to look at the bigger picture, not just one's own health, but also the kind of stress it creates on everyone else in and around them. So let's talk about testing. Who should get tested in the Auckland region?
So testing for COVID-19 is actually free of charge. So if somebody's been offered a test, or if they would like to still get tested, especially if somebody's got comorbidities, or they've got some chest issues, respiratory system issues, cardiac issues, they would like to get tested, they should go ahead and get it tested, because that's the way we'll pick up the spread in the community if somebody's positive in the community. And it's absolutely free. Nobody has to pay for it. Even if somebody does not have a visa, a valid visa, it will
Mhm.
still be free of cost. Um, Mind you, I need to highlight this, that if for people who do not have visa, this information is not going to be shared with Immigration New Zealand, even if somebody was to be tested positive. I think the only situation where you have to pay for this test is if you're planning to enter some other country. We have to watch for the symptoms for that. Anybody who has the symptoms of COVID-19, I think everybody's aware, but I'll just reiterate. So anybody with fever, new or worsening cough, runny nose, shortness of breath, Shortness of breath is the important symptom because it could mean that you're running into complications. Somebody with
Hmm.
sore throat or even temporary loss of smell. If you have any of these symptoms, or if you have been potentially exposed to somebody with COVID-19, please go ahead and get tested.
Certainly. Is there a last message you would like to give to our communities about what role can they play to stop the spread of this virus within the community?
I think the role of the community is very, very important. I really need to highlight this. If you take precautions, look after each other, and just remember we are in it together. So at the end of the day, if you think about yourself and your friend, your family, your neighbor, and just take the precautions we've spoken about, I think you'll do a really good job. And we've already done in the phase one of COVID. This is unfortunate that we're dealing with the resurgence of COVID again, but we've done this before. I'm sure we'll be able to do it again. Just be responsible towards yourself and your community, and that's pretty much what we are asking you for.
So the last question, if people need any information from Counties Manukau Health, where can they go? Which website can they go and get that information?
Absolutely. So Counties Manukau, we've got a website, and there's a lot of information around there who should get tested, and all those things, what we're speaking about. The website is www.countieesmanukau.health.nz/COVID-19. Just look up, there are updates, and there's a lot more information on this website. So please feel free to kind of look up on this website.
Absolutely. Thank you so much, Dr. Hari, for a very important message and advice for the community. As you mentioned, if you need more information, you can find it on Counties Manukau website. It's www.countiesmanukau.nz COVID-19. Thank you so much for your time, and you have a good day.
You to respond. Thank you.